All right. So just to go over where we left off yesterday. So we talked about basic outline. Our digestive system allows us to break down the foods that we eat and then absorb those nutrients. Yesterday we talked about just a few parts. We talked about first the mouth, where we start digesting our food by breaking it up into smaller pieces mechanically, but also by saliva starting to break down the starches. That's chemical digestion. From there, food moves down through the esophagus, which squeezes that food down into the stomach. Stomach is sort of pouch, muscular pouch that mixes the food around, contains hydrochloric acid as well as other enzymes, and that further starts to break down the food. And a couple things. So sometimes the hydrochloric acid is a pretty strong acid. It can be damaging. Like if you had regular hydrochloric acid that you got on your skin, it would burn, give you a burn on your skin. But it's inside of our stomach. Our stomach has special lining and special mucus that prevents the lining of our stomach from being damaged by these strong acids. Now, once in a while, this lining can break down, and a person's stomach can start to be damaged by this acid, and it can start to damage it. And that's what an ulcer is. We've heard about somebody with an ulcer. Usually means that the stomach acids are damaging the lining of their stomach. Also, we talked yesterday about heartburn, right? No. So heartburn, and how many people have had heartburn? Probably a lot of you. So heartburn has nothing whatsoever to do with your heart. Heartburn is a digestive problem. And what happens if a person has heartburn, acids from their stomach, for some reason, are creeping up into their esophagus. And usually those acids stay in the stomach. There's a little muscle between the esophagus and the stomach that kind of closes off. But if it doesn't fully close, some of those acids can rise up, and it causes a burning sensation in your chest. Really where it's burning is in your esophagus, but it feels like it's in your chest. And so if you have heartburn, you might take Tums or something. And those Tums tablets that you chew up and swallow, they're a type of substance, sodium bicarbonate or something, that counteracts an acid and neutralizes it. They taste chalky. And that balances out the acid, and it helps you feel better. People that get it all the time have heartburn like every single day. Usually they'll go on a medication that reduces their stomach acid, because having that acid in your esophagus frequently is not good for you. It starts to damage the esophagus, and that leads to problems. Just like we talked about the other day, person vomiting frequently, that can damage the esophagus as well because of those strong acids. No? So what I was saying, I must have told the other class, is that a person that, for example, a person with bulimia that makes themselves throw up multiple times every single day, so when you vomit, you're bringing up all the contents of your stomach are being brought up through your esophagus and obviously out your mouth. And so if you vomit, it doesn't taste as good as when the food went down, and that's because it's mixed with all of these hydrochloric acid and these enzymes as well. And so that could damage your esophagus. It also, person that is vomiting constantly, it starts to wear away at their teeth, because tooth enamel interacts with acids, and it eats away at their tooth enamel as well. So it can lead to a whole host of problems.
Is that what your teeth feel weird after you throw up?
Could be, yeah, because the acid, like your teeth are like the opposite of an acid somewhat, and so they interact with each other a little bit. So yeah. Continuing on with the vomit train of thought, if you've ever been really sick, you had the flu or something, you threw up, okay, you throw up once, most of the food in your stomach's gone. Maybe you throw up again an hour later, and now most of the liquid's gone. But if you keep getting sick, what eventually happens as you start to vomit?
It tastes worse.
It tastes worse. And what you're actually tasting is some of those digestive enzymes, like bile is a greenish yellow, really bad tasting stuff that after you throw up several times you might taste. That's a digestive enzyme that comes from our liver. Those acids are what that is. And you continue to vomit without anything in your stomach, that's all that's left there is those stomach juices and acid. I have 2 stories related to, 3 stories, two, I guess I'll get to one later. So when I was a kid, for some reason, my mother, when she would make meatballs, she'd fry meatballs in oil and stuff, but she would save the oil after to use it again like the next time. And so one time, for some reason, she put it in an orange juice container to save until the next time. So when I was probably 9 or 10 years old, I woke up, and I must have been tired. My parents were still in bed, and I went downstairs, and I got the orange juice thing, and I poured myself a glass of what I thought was orange juice, and I took a huge gulp, and it was disgusting old meatball oil, and then I vomited immediately. Vomiting is a reflex, too, to prevent your body from getting dangerous or poisonous substances inside. It's also why bad smells and stuff, they make us gag or make us vomit. That's a protective mechanism, because usually those things that smell bad could be dangerous to us if it's something spoiled, or it's feces or other vomit. Those are things that can pass pathogens on to us, and so we have a natural reaction to avoid those things. My other story was that also when I was younger, you know what Crisco is?
Yeah.
It's in like a tub. It's basically just fat. I always thought when my mother was using it that it was vanilla frosting. And so I would ask her, and she'd say, "No, it's not frosting. It's whatever." And so I would believe her, of course. So one time when she wasn't around, I went in the cupboard and I got the whole thing out and I scooped up like a big glop of it. And really, it's just pure fat. It's just this greasy, disgusting, solidified vegetable oil. But I put a big glop of it in my mouth and I tried to swallow it up. I immediately vomited afterwards. Yeah.
I don't do that.
What?
Like if I've had I've eaten Crisco.
A big glop of disgusting Crisco?
I've also eaten deodorant when
Is that like as a breath freshener or something?
It doesn't taste good.
Some people
very rarely vomit.
Some people have stronger like gag reflexes and a more propensity to vomit than other people. It's just sort of a natural thing. Logan?
How come if you like out of shape and like you run a lot and then you like throw up after?
Yeah, it's sort of. All right, here's another. So sometimes when you physically exert yourself, not just sort of that you're tired, but if you really go beyond that, then you can become sick afterwards. If you're trying to run and you're running so hard, after you finish, you may throw up. Last 4 years after the Boilermaker, I've gotten sick every single year. Because
Michael Garcia, we had to run a mile out of school. We had to run 6 times. He sat down in a chair and immediately vomited.
Yeah, it does. When you exert yourself, and again, sometimes that's your body's reaction because you've exerted yourself, and your body's basically saying, all right, I'm in trouble, I'm dehydrated, or I need to conserve my energy. I'm not going to waste any energy digesting this food in my stomach. I'm going to get rid of it so I can conserve that energy to keep myself alive.
Doesn't it take energy to throw it up?
A little bit, but probably it's your body's way to just sort of conserve, because afterwards you don't have that food to try to work to make enzymes and digest it off. Yeah?
2 questions. Did you pour like the thing of orange juice or whatever it was into a cup?
The oil, yeah, I poured it in a cup.
So when did you see what color? it
Well,
was?
it's like kind of, oil, like olive oil is kind of like yellowish, and I was probably tired, or maybe it was like a cup and it wasn't like a glass, but like a little plastic Snoopy cup or something. I don't know. All right, Jaden, then we got to get off of my vomit stories. Go ahead, Jaden.
After the mile run,
Yeah.
in 5th grade, I got 6:50 in the mile, and then I threw up,
Yeah.
and then she took me to run. She gave me a case of run up there before you throw up again, and then I ended up throwing up on the way there.
Yeah, it does. That happens when you're really pushing yourself. When you're pushing yourself to the sort of limit of what you're able to do. All right, we need to continue on. So from our stomach, after our food has been sufficiently broken down, it's, remember, called chyme. It's sort of liquidy. It's sort of no longer identifiable as the foods that we chewed up and ate. It's been digested quite a bit. Then it can start to move out of your stomach. So if we look at in this model here, I'll show you the different organs. So remember, we chew food, swallow it, and then it goes down our esophagus. So the esophagus in this model goes down behind. This is the trachea up front. Behind it is the esophagus, and that leads over here. So this is the stomach. Your stomach is actually pretty high in your abdomen. It's just underneath your rib cage. A lot of times people think their stomach's down here. Your actual stomach is up high around your rib cage up here.
Oh, is that why if you get hit right there it hurts?
Sometimes. It can hurt for lots of reasons. So anyway, this is your stomach. From there, so we'll get there. From there, the food passes on the right side of your body, sort of around the middle of your abdomen. The food passes into your small intestine. Most of your abdomen is filled with your small intestine. And so the small intestine is this very long tube that it's all wound up inside of you. And it sort of travels back and forth, all these different folds, so that it can fit in there.
Isn't the small intestine bigger?
So the small intestine, it's very long. It's 20 to 25 feet long. And it's, so why is it called the small intestine? It's not called small because of its length. It's because of how narrow it is. So compared to the large intestine, it's much narrower. If you, like, for example, took my small intestine out, it would probably stretch from here to the back of the room. That's how long my small intestine would probably be. So, hold on. As this small intestine winds throughout your head, and the food travels all along the way. Now, it takes a little while. It's a pretty long journey. And along the way, what's happening is this is where we digest the most of the food, and it's where most digestion happens. It's also where we absorb all of the nutrients from the food. So as that food's making its journey through the small intestine, you're absorbing the sugars, the amino acids, the vitamins, the minerals. They're all being absorbed so that you can actually use them. So the way you actually get the useful things out of your food is you absorb it in your small intestine. Because surrounding the small intestine, there are these blood vessels that are able to absorb that. And so most digestion also occurs there. There are several organs that produce enzymes that help to break down this food. And they sort of squirt these enzymes into the beginning of the small intestine so that as this kind travels through, it gets further broken down. So here in this diagram, we have our esophagus, the stomach's over here, and then it wounds down into all the small intestine. Jane?
Isn't the small intestine like the width and the length of a basketball court? Because that's so long.
So we'll talk about that in the next slide. So give me 1 minute. Dan?
What's bigger, the small intestine or the big intestine?
The large intestine's wider but shorter. The small intestine's longer but narrower. So it's named small and large because of the length. I mean, not because of length, because of the width. So along with our questions, Logan?
Is that why you want to wait a little before you do, like, run or something after you eat?
Sometimes, because as you're running, your body will use that energy, first of all, for you to run. And then what that means is that a lot of that food that you've eaten is not going to be digested because your body's using its energy for exercise. And so it can be uncomfortable, it can be just sort of sitting there. You could have like stomach pain or intestinal pain. Tim?
What is the large intestine?
We're going to get there. So small intestine winds around to where food's digested. Along the way, these organs are helping digestion by producing different things. The liver. So the liver is this very large, it's one of the largest organs in our body. It's found right up here. And the liver does a couple different things. It produces a substance that's called bile. And bile, like I said, it was that sort of yellowish-green substance. And bile is important. What it does is it helps our body to break down fat. So it breaks down fat so we can absorb the nutrients that are found and the energy found in fat. But also the liver has another important job in the excretory system. It helps filter our blood. It helps remove poisons and toxins from our blood. So it does multiple things. And the liver produces bile, and it goes through what's called the bile duct here. But there's also another little organ there called the gallbladder. Yeah, my wife had hers taken out. A lot of people, it's a common. So the gallbladder basically stores what? The gallbladder stores bile for a time when a lot of it is needed. So the liver makes bile. Some of it sends into the gallbladder so that when you need it, it's there ready to be stored. It can be sort of squirted into the small intestine. Now some people do get like secretions like gallstones in their gallbladder that can become very painful. The gallbladder can become infected. Some people do, they have it removed if they're having problems with it. And you can live no problem without your gallbladder because the liver still makes bile, but instead of it getting stored over here, it just goes directly through the bile duct into the digestive system. So it's still, you get the bile that you need. Sometimes people need to adjust their diet a little bit because they may have more difficulty digesting fat. So it's sort of, people adjust fairly quickly to that. So the gallbladder basically passes this bile into the small intestine where it can help to break down fats. Jackie?
My stepmom, she had hers taken out, and she is gluten intolerant and lactose intolerant. With the gallbladder, everything was good.
Not usually, not with those two things. The gallbladder is sort of a separate issue than, gluten intolerance, called celiac disease sometimes is an allergy basically to certain a protein that's found in wheat products. Lactose is a sugar that's found in dairy products, and so a person can also be allergic to lactose as well. Tim?
Like, my uncle had a problem with iron, so he had to get part of his liver removed, and he was on a strict, no red meat, no, alcohol.
Oh, yeah.
So, just alcohol is technically a poison in our blood.
Yeah, and alcohol is removed from the blood and metabolized or broken down by the liver. And so the liver does that. And for example, if a person is an alcoholic and drinks all the time, over time they can develop cirrhosis of the liver, which is basically the liver becomes damaged progressively more and more over time, and they may eventually need a liver transplant, or they can die from that as well. Rachel?
Well, my grandmother has gallbladder disease, so what is that?
Yeah, it's just basically like an inflammation of the gallbladder, that's what Lonnie was talking about, or my wife. They would get that gallbladder, and it's very painful when you have an attack of that. So sometimes they remove the gallbladder to help get rid of that. Other times a person may try to just deal with the symptoms and so forth. Sometimes little, they're not really stones, but little secretions form, and they're very painful as they move through the bile duct and so forth. Karina?
What secretion?
Like a little thing forms, just a little hard, sort of like a pebble forms, and when that moves through the bile duct, it hurts.
This year, when me and my brother shot turkeys and we were cutting them, there was a big pouch and there was rocks and stuff in there.
Oh yeah, birds swallow rocks. It's called a gizzard. And they swallow rocks, and they use that to help them grind up foods that they eat.
That's so weird.
All right, there's the crop and the gizzard. All right, so another organ in this example, it's here with it's with the above the small intestine, underneath the stomach. It's called the pancreas. The pancreas, we already talked about that it produces insulin, but it also produces a bunch of digestive enzymes called pancreatic juices that help to break down different foods. Okay. So those organs, the food doesn't go through the liver or through the gallbladder or pancreas. They just add to these digestive enzymes. All right, so after the small intestine, food makes its way all through those 20 or 25 feet of the small intestine, and then eventually it's left to go through the large intestine. So the large intestine on this model, it's in gray, and the food enters the large intestine here on the left. Then the large intestine goes up your right side of your body, across your abdomen, down the left side of yours. So up, across, and down. And, before we get to that, in the small intestine, in that tube, like, it's not smooth, it's not like a hose inside. It's not a smooth tube 25 feet long. Inside it has all of these ridges, all of these bumps. They're called villi. And what they do is they increase the surface area of the intestine so that the maximum amount of nutrients can diffuse into the blood. Those are called villi. And that's what you're talking about when you're talking about the size of a basketball court. Is that if you were to look at the surface area, it's very, very large. And the purpose is to allow your body to absorb as much of the nutrients in your food as possible. And so as the food's moving over these villi, nutrients go into these blood vessels to be carried throughout your body. So finally, we're almost done with our journey through the digestive system with the large intestine. So the large intestine goes up, across, and down. And basically, by the time food has got here, or it's not food anymore, by the time has got to the large intestine, all of the nutrients have been, most of the nutrients have been absorbed. It's fully digested, so no digestion happens there. But along the way, there's still a fair amount of water mixed in. And the large intestine reabsorbs this water so that we can sort of recycle it within our body. But there's no digestion taking place in the large intestine. Just basically absorbing any excess water from the chyme.
I thought it was chime.
Chyme, I think. I've heard it pronounced both ways. And so as that material moves through the large intestine, the water gets reabsorbed. Now what's left of the food really is stuff that's undigestible, fiber, plant matter. There's lots of dead cells from the inside of our digestive system. There's some bacteria that live inside of our digestive system that are helpful to us. And all that stuff is what's left. After the water is reabsorbed, then it's just left is what we call feces. That is eliminated from the body through the rectum. Yes, Caleb.
You chew corn,
You do chew
and
corn.
it goes through your digestion, but
It does.
it still comes out like whole.
Well, what actually comes out, so the stuff inside of a corn kernel has like sugar that tastes sweet and so forth. So your body uses all that stuff. But the outer seed coat of a kernel of corn is undigestible. And so that is not used by the body. We don't have the enzymes to break that down. It's like a form of fiber. It's just like when you eat a salad, lots of the lettuce is cellulose. It's not digestible by us. So it travels through our digestive system and then out.
This is another weird
Okay,
question.
great.
But, like, people talk about bowel movements. What is that?
I mean, a bowel is another word for sort of your large intestine. And a bowel movement means eliminating that feces, going to the bathroom. That's what a bowel movement is.
So like,
It means that the waste products that are left are now eliminated. Green. That's the rectum.
Is that like your acid,
Down here?
Yeah, it like flips.
No, this is where solid waste comes out.
Okay.
If it's squirting out, it means you have a problem, and maybe you have like food poisoning or diarrhea. So when a person has diarrhea, what's happened is that their large intestine has not absorbed all of the water. So like we said, the job of the large intestine is to reabsorb water. If it doesn't take out enough water, then that waste is still very liquidy, and that's what diarrhea is. All right, one at a time. I'll get to all these questions eventually.
Don't ask questions. Oh, it's brown.
So this is the stomach, small intestine, large intestine, and out.
What's that brown?
That's the liver. The other thing in terms of the large intestine, you can't really see it on this diagram, but this part, the ascending colon, there's a little thing, it looks like a tail here. That's what's called the appendix. And the appendix is sort of a little extension. It's just a tiny little narrow tube. And what happens is sometimes it becomes infected. Like when I was 12 years old, I got appendicitis. And so for some reason, so that day when I got appendicitis, I was sick. My parents just thought I was sick or had the flu or whatever. But then I kept throwing up, so I threw up like 38 times in that one day. And I was counting. So my parents took me to the hospital because they knew obviously something was right. You have pain in like your right side. Your appendix is on your right side in your lower abdomen. And so if you have that pain, you go to the doctor. If your appendix gets, guys, if your appendix gets infected with bacteria, it can swell up. If it bursts, it then spills those bacteria into your whole abdomen, and you can get very sick. You can die from it. So that if you have appendicitis, generally, they will remove it. So they basically make an incision down in your lower right side, cut out your appendix, sew you back up, and then a couple days later, you're recovered. When I had mine out, after being in the hospital for a couple days, and at first you can't really walk very well. You have to cut through your abdominal muscles to get at your appendix. But I went home after a couple days. But what happened to me was I was sitting in my kitchen. I can still distinctly remember it. I can remember even the pajamas I was wearing. But I was sitting there at the counter. I just got home, I think, the day before. And I don't know if I was having cereal. I might have been having cereal. But all of a sudden, I started smelling something horrible. Like this awful stench. And I smelled the milk to see if the milk went bad. I couldn't figure out what it was. But then I lifted up my shirt, and my incision had gotten infected. The stitches had burst open, and my whole stomach was all covered with pus and bacteria. And that's what I could smell, this awful smell. So my mom had taken me back to the hospital. They had to reopen the wound that had started to heal.
Did you feel it?
Yeah, because they didn't get anesthesia. They needed to get it cleaned out right away. So they just kind of, it started to heal, so they just kind of spread it apart to open it back up again and clean it out, give me antibiotics. Yeah, that hurt. And then after it healed up, it was fine.
Were you crying?
What?
Why did they give you anesthesia?
Because they need to do it quickly, and you can't give somebody anesthesia. What?
Were you crying?
I don't think I was crying. I know it hurt.
I bet you were.
All right, few questions, then we have to finish our notes. Hold on. And I wanted to show you this video. Kayla.
Is it okay if I ask a question about poop?
Sure. You've already had a question about poop. Go ahead.
Why? Sometimes you not.
It depends on.
Oh my God.
So it depends on. Guys, depends on what you eat. So poop. Listen, poop is the remains of leftover food. So depending on what things you've eaten, that's what's going to be in the feces, and so that's what. That's a scientific term for poop. All right, quickly, Tim.
Okay, so my dad got his appendix removed, not yesterday,
Oh, really?
last year, and during the summer. So he had an incision,
Yeah.
and they didn't they left a little hole so that all the stuff would come out. I
Yeah,
don't know.
drain out. Yeah.
And so he had the thing, and he had to change it. And I'm like, Dad, I want to see your incision. So he pulled up his shirt, and at that exact moment, all the stuff started coming out. It was disgusting. It was red, blood. And I'm like, Dad, you're gonna die.
Sometimes after surgery, they leave a line in there to drain fluid, so it doesn't swell up. So and then they eventually take that line out. All right, quick, Rachel, then we gotta go.
My dog ate purple carrots, and he started, and he pooped.
Yeah, my dogs have done that too.
All
right. Your dog's name Magenta. All right, so this is the esophagus. That leads into the stomach. From there, food travels through the small intestine first, and then here is the large intestine.
Speed up.
So that's the pathway that food travels through. Also, along the way, the liver adds bile. The gallbladder stores that bile, sends it into the small intestine, and then this is the pancreas that's just underneath the stomach.
So if your stomach popped, your pancreas would get all stomach.
Yeah, that'd be bad. All right, I want to show you this video.